In tonight's Fox Focus, for many pet owners, spaying and neutering is part of owning and caring for your animal.
But some owners are concerned about the pain that their pets have to go through after that procedure. As Fox 23's Kristen Lauman explains, though, that pain has been cut down in the Capital Region thanks to a surgery that's new to pets, really common for people.
Okay, this is Lizzie. Lizzie was done just a few hours ago. Hi, honey.
Looking at Lizzie, you'd think she was a normal, happy, curious cat. But it turns out just hours ago, this little girl had a major surgery.
But that's it. You can see a little bit of glue on the tummy.
See, Lizzie was spayed, but not in the traditional way that you might be thinking about.
We spent a whole year gearing up for this, between researching equipment, training. It took us 1 year.
At the animal hospital in Guilderland, they have equipment you might be used to seeing at area hospitals in human surgeries, because here they're doing surgery laparoscopically on pets.
There's only a handful of hospitals in New York City, and that's it. There's nobody else in New York State, so it's not just the area. We're the first north of the city.
The surgeries are done through small incisions. In Lizzie's case, with a spay, just 2.
Smaller than my pinkies. They're 5 millimeters, and we use 1 suture in each in the muscle, nothing on the skin except for a drop of a very high-tech 3M tissue adhesive. And they go home that afternoon wide awake and wagging their tail.
In surgery, carbon dioxide fills the belly to give the doctors room to work, and a ventilator helps the animals to breathe.
The instruments work through one trocar, the one that's in the front or the upper, and the camera with what's called a telescope works through the other.
And with smaller incisions and less wear and tear on the tissues, studies are showing that the surgery results in less pain for the animals and puts them less at risk.
With this procedure, we're going to the organ, where it sits, where it lives, and we're visually watching what we're doing to it with no encumbrance. When you tie off a vessel, you're tying a knot, and that knot can slip. If they go out the door and trip on the stairs or trip getting into the car and fall hard, they're really at risk.
There's no tying off vessels with this procedure. A special instrument complete with computer boards, along with the veterinarian, does all the work.
This melts the collagen, it seals it, and then there's a button you push. The computer tells you when it's done, and then a blade moves this way and just cuts it as you're finishing. So it's very fast and very safe and effective.
This equipment was a significant investment for this animal practice, one that they say they know they will never recoup. Because for this hospital, it's not about the money. It's about these guys and giving them the best care they can. With tonight's Fox Focus, Kristen Lauman, Fox 23 News.
Interesting story. Now, the cost of this has gone up a bit, but only minimally at the animal hospital.
Dr. Becker wants to keep the procedure affordable and has talked with other Capital Region practices interested in bringing the surgery to their offices.